Welcome to another episode of the Federal Newswire's Business of America podcast with your host, Gerry Rogers.
Welcome to another edition of the Business of America podcast, where we talk to the most important people in America, those who are the doers, those who are in the arena. Teddy Roosevelt talked about the man in the arena. We talk to the men, the women who are running America. The advocates, the scientists, the executives, anyone who is moving us forward. And today we're blessed to have with us someone who I've known for a long time. And I think this might be the first time in maybe years since our CPAC days where I've actually had a chance to interview him. I'm talking about, of course, Peter Roff, who is a Newsweek columnist, but he's more than that. He is ubiquitous. He's a TV guy. He's a news guy, commentary guy. He's a movement guy. And why he's our guest today is because we're doing our series on the business of nonprofit hospitals, which will expand to the business of nonprofits broadly. And I think Peter can even talk to that. He's written about nonprofit colleges. But for today, we're talking about nonprofit hospitals. We had Peter Pitts on last week, Peter Roff. It's the tale of two Peters. So we have Peter on with us today. Let's just set the context here. Crushing healthcare costs. Americans are fearful of going to the hospital, of getting a doctor's bill, surprise bills. And we just had this big debate in Congress about healthcare cost, Medicaid. But I wanted to scream, it's the hospitals, Senator. It's the hospitals, Congressman. But they passed the One Big Beautiful Bill Act, which is, I think, good news broadly. But we still have to deal with hospitals. Nearly 20%, 17.6% of the U.S. GDP is healthcare spend. And when you ask someone, well, where's all that money going? Well, it's the drug companies. The drug companies. Well, in reality, the drug companies are 10 cents on the dollar, the healthcare dollar. Hospitals, Peter, 30 to 35%. Tell us about the. In my mind, I think we have a nonprofit health crisis in this country.
Thanks for having me on, Gerry. Listening to the introduction, I didn't know who the guest was. Realized you're talking about me. I don't know how much of a mover and a shaker I am, but I do have my opinions, and people sometimes actually give me money to express them, so I presume they have some value. And we have a healthcare crisis, but it's a government healthcare crisis, and it's the way that government has inserted itself into the healthcare industry on the grounds of protecting people, the nanny state, that has screwed up lots of things. I grew up in a healthcare family, and my father, who started his practice before the advent of Medicare and Medicaid, used to bemoan how the government getting into healthcare in a big way really destroyed its character. He used to say, all these patients that I see on Medicaid, I treat them for free if the government would allow me to, simply because I spend so much time and so much money on lawyers and accountants filling out the forms. And I always have to worry that some government investigator is going to show up and accuse me of providing a service that I didn't provide, but billed for it anyway. And so the problem is largely speaking, is there's too much government intervening in the relationship between doctors and patients. But the specific thing that we're talking about today is that I followed up, Steve Moore, the economist that we both know, wrote a piece in which he called
Steve Moore, former White House guy, Unleashed Prosperity guy, Wall Street Journal guy, Heritage guy.
Just brilliant. Just brilliant.
Yes.
Wrote a piece in which he said we ought to abolish the tax-exempt status for colleges and universities. And I took that as a cue to look at what else was out there. And we now have multi-billion-dollar hospital chains operating as not-for-profit businesses, meaning you and I pay for them because our tax rates are higher because they pay no tax.
Right.
That are businesses. They're multi-billion-dollar businesses, and they ought to be taxed as such. And if they were taxed as such, I suspect they'd be a lot better advocates for less government in the healthcare system than they are right now. Not to mention the fact that it would bring in billions of dollars that currently go untaxed that would allow Congress and the president to cut your marginal rate and my marginal rate so that I'd have more after-tax income to spend on my healthcare.
That's again a brilliant point. This is our second program on this issue, and we haven't touched on that. The more government involvement, Fred Smith from CEI, the founder and longtime president of CEI, and I know that you knew Fred. Fred's passed away, God rest his soul. But Fred used to talk about how if you take government on as a partner, well, then you begin to manipulate, lobby.
There's a great scene in Goodfellas.
Okay.
And I'm going to presume that this is a PG.
It is
plus podcast.
My mom watches the podcast.
But there's a scene in which the guy that owns the Bamboo Lounge takes on Paulie as a partner.
Yes.
And Henry Hill's voiceover comes on and says, well, but now he's got Paulie as a partner. And so you had a bad week? Fuck you, pay me. The shipments didn't come in as you expected? Fuck you, pay me. The clientele disappeared? Fuck you, pay me. Well, taking Paulie on as a partner is kind of like taking the government on as a partner.
Yep. Again, people don't realize 1 out of every $5 in the U.S. is spent on healthcare costs. People don't realize that 60% of all hospitals, Peter, 60% of all hospitals are nonprofits. And you're right, because it's the taxpayer, it's the patient, it's the caregiver, it's the physician who ends up getting the short end of the stick here.
And again, there was a time when that might have made sense. When a hospital was something a community needed and the capital to support one didn't exist. So in order to keep the local hospital running, we have to make some compromises. We'll give them an exemption on paying taxes to lower their capital costs. But now all of those little hospitals are now parts of big hospital chains. They're not run by Dr. Farmer or Dr. Taylor. They're local community general, a branch of Mega Hospital Corp. Or they're connected to University Hospital, a teaching hospital. There used to be dozens of hospitals in Manhattan where I grew up, in that general area, Manhattan, the Bronx.
So Peter, I just as a side note, I grew up just north of you in the Bronx.
Right. Okay. Well, I grew up actually just north of you in Westchester, but I'm just saying in that whole area.
Yes.
There used to be dozens of hospitals.
Sure.
And every time a hospital proposed closing, it was a crisis because of the underserved impact, the impact on the underserved in that community. But now they're all part of one chain associated with a university or another chain associated with a large not-for-profit hospital. And now they specialize. So it's not, there's not a hospital. It's a cancer hospital. It's not a general services hospital. It's a It's a psychiatric hospital. It's not a general services neighborhood
Sure.
hospital like a neighborhood school. And they're all part of a big chain. And they take in billions of dollars. And part of what they do is, and this is just a marketplace reality, and where government again interferes. The government comes in and says, we're going to regulate how much you can charge for this and how much you can charge for that. The insurance company comes in with the backing of the government and says, well, we can't regulate how much you charge, but we're going to regulate how much you pay for, how much we pay
Right.
for. So you can charge $500 for this service, but we're only going to pay you $250. So you can either go collect it from the patient or write it off. Well, what happens? They end up hiking the price on things like aspirin and the bottle of water that they bring to your room and telephone service and all the things that aren't regulated. So you get these crazy bills. Why you charge me $12 for an aspirin? Well, I charge you $12 for the aspirin because I could only charge you $10,000 for surgery that costs $25,000.
Right.
You can't change what things cost just by changing the number.
Sure. And I know that you've written on this. I did a little research. You've written about the nonprofit crisis at colleges and even hospitals for, years ago, I saw some pieces from you. You've had some recent pieces. I forget, Washington Times, perhaps, or maybe it was Newsweek. I forget. But you had a recent piece and you talked about something called the fair share deficit, where the hospitals are taking in all these tax benefits, all these tax breaks, and yet they're not spending the money on charity care or the poor as they're supposed to. Talk a little bit about the fair share deficit.
Again, the hospitals, like anybody else, they're not for profit, but they can't spend more than they bring in. So if they do, they either go out of business or they turn to the state or they turn to the federal government and they say, we need extra money. We need a bailout. You heard some of this conversation about how the cut in the rate Medicaid is going to increase under the one big beautiful bill is going to cause all the rural hospitals to close. Well, convenience aside, if it takes that little to close a hospital, then, maybe in fact, the hospital should close because the services can be provided cheaper, better, more efficiently if there was some consolidation. This is the other thing we have to get under control is that hospitals are like post offices. It's very hard to get one open, but once it's open, it's almost impossible to close it. Because the constituency it serves, you can't there's a hospital 3 blocks from my house. Great. We're going to close it. You're going to have to go to the hospital 3 miles away. Oh, no. You can't do that. You can't do that.
And not only is it the constituency, but it's also, again, you bring government in as a partner. Well, then you have to hire more executives, more pencil pushers, more lobbyists, more accountants, more lawyers. And what we see is, like, for instance, you mentioned Manhattan, the hospital associations in New York have spent close to $25-30 billion on lobbying, nonprofits lobbying the governments from which they receive benefits. Again,
to
get more benefits. But
that's become part of their business. And that's ridiculous. If they had to pay taxes, if they had skin in the game, I think it would help get healthcare costs under control because they have to be more responsible to the marketplace. And things like hospital transparency, where I need to have my gallbladder removed, which I did, and it didn't matter because of my insurance which doctor did it or which hospital did it, as long as it was covered under my insurance plan. I had no incentive, and the hospital provided me, the hospitals in the Northern Virginia area provided me with no incentive to shop around. Was it cheaper to do it in Alexandria or Fairfax or in a private surgery center? I didn't need to look. My surgeon was on my plan. The hospital was on my plan. The only thing I had to worry about is that they were going to slip somebody onto the surgical team that wasn't on my plan, and I'd have to pay the real cost.
Right.
And hospitals don't have to be careful about that. They have to be more careful now about surprise billing than they did. And I, in fact, had another procedure where the doctor who performed it was in a practice covered by my plan, but the hospital tried to say he wasn't. And so we had 6 months of going back and forth about who had to pay for, and I ultimately prevailed because what I uncovered was a paperwork snafu. The guy should have been on their list and wasn't. How many people just paid the bill without fighting?
So on that price transparency, you wouldn't go into a restaurant or a grocery store or to go purchase a new car without knowing the prices or some understanding of the price points. It's interesting that, and that's the law now, but hospitals aren't complying. Everything is fee for service because that's how they get more money. But just a quick anecdote: my wife had a procedure done 3 years ago, and she had to remove a stint. And the doctor said, "Do this from home," and so she did it from home. And I get the bill, and there's a large bill for the removal of this stint. And I'm like, Erica, we did that at home. Why are you being charged for this? And my point is, a lot of people would just pay it, or the insurance company would just pay it. So I called the practice, and it was a practice associated with a hospital chain, a hospital system, and they said, "Oh yeah, it's for the facility." I said, "Well, the facility was my bathroom. Are you going to pay me?" And my point is, we only knew that because we looked at the price. Often people just go to the hospital and they come in with these tests and everything else, and you're sick. Gallbladder. I recently was in for for a heart scare, and I'm tired. I'm sick. I don't know what's going on. I'm in the hospital for 6 days. I have a little bit like I'm in a jail cell mentality, and they're coming in saying this, and this. And I'm saying, okay. Why? Because I guess insurance covers it. It's also fee for service, which also drives up the high costs. And I guess, you and I are policy people. We look for solutions. I do believe there are solutions here. One is we have to look at the nonprofit status. We have to enforce price transparency. These consolidations where hospital systems are purchasing medical practices and they can charge different prices there. These are all things that the Congress or even at the state level can deregulate and move us forward, so we're getting a better spend, a better quality.
And it's fascinating when you talk to doctors who sold their practice to a hospital chain.
Yeah.
And they did it for simplicity, for liability protection, not because it made them better doctors, not because it made them richer, but because it took all kinds of responsibilities away from them. But it also imposed all kinds of responsibilities on them, like the number of patients they have to see, which means you're not necessarily giving every patient the kind of examination, the kind of care. We worry a lot about patients getting too much testing because the government pays for it. We don't worry about patients not getting enough face time with a specialist or with a general practitioner, because that's not a pay-for issue. That's a quality of healthcare issue. And we'd be a lot better off if the healthcare community could focus on quality of care issues rather than payment issues. And I think if we removed the tax-exempt status from the large hospital chains, from hospitals generally, it would certainly have a beneficial effect on the overall economy, on economic growth. It would generate income for the government that it is currently foregoing, that would allow them to reduce rates for everybody else across the board. That's the secret of tax reform. Broaden the base, eliminate deductions and credits. More people paying in means everybody gets to pay less. But I also suspect it would change the healthcare culture in hospitals so that things would become more in line with the kind of things that patients care about. They'd spend a lot less time lobbying for subsidies and a lot more time lobbying against additional government control. If
Yep.
I've got to show a profit for my shareholders and I've got to pay taxes, I can't mess around with income anymore. I got to get serious about this and I got to get competitive, which means I got to offer, I got to run specials. Hey, come have your gallbladder removed at 3 o'clock in the morning when nobody's using our surgical facilities, and you can have your gallbladder removed for 75% what it would cost you if you did it at 4 o'clock in the afternoon. Because, now if you have your gallbladder done laparoscopically, you spend a couple hours recovering from the anesthesia, you get up and somebody drives you home, which is
Yep.
better healthcare outcome. Because, we haven't talked about hospital-based illnesses that keeping people in the everybody complains that, we used to get 2 weeks in the hospital after you had a baby, and now you go home after 2 days. Well, the fact is hospitals are places where sick people are, and you don't want to be clustered around sick people. Sort of like
Right.
when recovering COVID patients into nursing homes, and the people in the nursing homes got sick, and you sort of look at Andrew Cuomo
Sure.
and go, "What were you thinking, you idiot?" But he doesn't want to answer that question. But you have to be, the turnover is faster resting at home where you're not surrounded by sick people, which is
Well,
less expensive treatment and recovery, keeping hospital beds. And this is the other, during COVID, we talked about how the hospitals were being overwhelmed. Well, that's because hospitals have to run at 95+% occupancy all the time to make the numbers work. Now, that doesn't necessarily lead to the best quality of healthcare.
sure. Well, again, and that's again just a takeaway for the audience, and that is healthcare right now is governed by government, from government interference, from government interaction and taxes and regulations. And it seems to me that the way the nonprofit hospitals are working now is putting for them profits over patients, and it's bad for overall health. Our policy should be right treatment to the right patient at the right time at the right cost. And everything's in place to do this, except for the political will, perhaps, and perhaps because, again, Fred Smith. I'll say his name again. Fred Smith used to say in politics, people were stupid because they were smart. They did not focus on something or get well versed in something because they couldn't affect it. They couldn't change it. So they were worried about the soccer game or the grocery bill, but not. However, that's changing. I worry about hospital stays now. I worry about my healthcare costs now. Polling shows, right? Even the last election, 2024, healthcare was a top issue. And I don't think we're addressing it right. We have a few minutes left. I mean, are there, you mentioned re-examine the nonprofit status. Do we need a regulator to regulate the nonprofits? Or, I mean, what are some other
Oh,
solutions
God,
here?
no. Oh, God. One more. Look, we want, when the British burned Washington, Dolly Madison took all of the essential government documents and the Gilbert Stuart painting of Washington out of the city in an ox cart.
Yep.
The most important government documents fit in an ox cart. I'd be happy if we could get government down to the size where even an ox cart full of thumb drives
Yep.
was it. And we're not even close to that. So the last thing we need is more government. I want to tax the not-for-profit hospitals as a matter of economics, as a matter of tax reform, as a matter of getting us to a fair, flat tax where everybody has skin in the game. The quickest way to get for people to vote for socialism is to take them off the tax rolls. If they don't have skin in the game, if they don't have to worry about what they're paying in taxes, and that's personal taxes or corporate taxes, even though corporate taxes ultimately are paid by the consumer of the goods or service the corporation provides, the quickest way to turn people into socialists is to take them off the tax rolls. But I also agree with you that there would be a beneficial effect on healthcare, because hospitals would be just as worried about the bottom line as General Motors is, as General Dynamics is, as IBM is, as Google is. The bottom line,
as mom and pop Main Street shops are, right?
If the bottom line doesn't matter, then why you really don't have to keep track of it, except you've got to fill out a form someplace.
Yeah.
You don't really have to care about how you're spending your money.
Yeah, you started the program off talking about this relationship with government, taking government on as a partner, the nonprofit hospitals. One thing that, we can end on this. We've seen the government explode the last several decades. I mean, for 200 years, but certainly the last several decades.
Since Wilson in 1912, and then FDR in 1932, and LBJ in 1964.
And in the last 30 years or so, we've seen hospital prices increase by 250%. It's not a coincidence that as government grows, our healthcare costs grow as well, right?
It just like it's not a coincidence that the more money the government has put into education, the more expensive tuition has become at private and public universities. Money chases money.
That'll be our next conversation. I want to talk to you about nonprofit universities and their status and their endowments and everything else. But I think,
and we haven't talked about the worst part of all of this. Is at the end of the day, Gerry, you and I are paying for this. Every person who's watching this podcast who pays income taxes is paying for this, and we're also on the hook when it goes bad. Yeah. There's no hold harmless that says, oh, no, you go into bankruptcy, no taxpayer bailout, whether it's a college or the post office or a hospital, there's always a bailout associated because the service is just too important. So you and I end up paying for it. We pay for it going in, we pay for it while we're in it, and we pay for it on the other side. And that's what's fueled a lot of the populist resentment that's driving the current level of political anger on both the left and the right. We're paying, each of us may not like the services the other side wants, but we all object to paying for services we're not getting. When the mail's late, when the road's not paved, when the trees aren't cleared after a windstorm, when I can't get the surgery I need because of the wait time at my local hospital. I'm paying for these services and I'm not getting what I pay for. And one side solution is always, well, we'll just put more money into it. We'll make it more expensive. Well, the top 5% of wage earners are paying what? 49% of all the revenue in income taxes? That doesn't strike me as fair.
Peter Roff, smart guy. I do think you're a bit of a go-to when it comes to these important issues. We're going to continue our conversation on nonprofits. I'll have you back on and talk about. We'll talk about anything. But I wouldn't mind talking about colleges with you. But thank you for your time today, and to the audience, thank you. This has been another. I think every episode is better than the last, right? I joke about this. My grandfather used to tell my grandma would ask him, hey, Joseph, how was the meal? Best I ever had. But then she'd get upset because what about last night's meal? Well, every show we do here is better than the last. And Peter, I appreciate you. Anyway, to our audience, God bless you. Thank you. Find this podcast wherever you look for podcasts. Like it, follow it, comment on it. Let's make the business of America explode. I'm Gerry Rogers, your host. We'll see you next time. Thank you.
This has been the Federal Newswire's Business of America podcast, hosted by Gerry Rogers. Check out the Federal Newswire's family of websites, as well as their social media stream